Paraphilias and sexual dysfunction are often overlooked, so we are going to go over high-yield practice questions so you don't get them wrong on the exam. Question 1. A 34-year-old man reports recurrent, intense sexual urges involving exposing his genitals to unsuspecting strangers in public places. He states that the behavior causes him significant distress, and he fears he may eventually act on these urges again. These symptoms have been present for 8 months. Which diagnosis best fits this presentation? A. Exhibitionistic disorder. B. Voyeuristic disorder. C. Frotteuristic disorder. D. Sexual masochism disorder. Or E. Transvestic disorder. The answer is A. Exhibitionistic disorder. Exhibitionistic disorder involves exposing one's genitals to an unsuspecting person for sexual arousal. The diagnosis requires at least 6 months of recurrent urges, fantasies, and behaviors, and there must be distress, impairment, or acting on urges with non-consenting person. So if you think about exhibition, it's showing off something they like showing their genitals. Question 2. A 42-year-old man reports sexual arousal from secretly observing individuals undressing through apartment windows. He has acted on these urges several times and was arrested after the neighbors reported him. Which condition is most consistent with this behavior? A. Voyeuristic disorder. B. Exhibitionistic disorder. C. Frotteuristic disorder. D. Fetishistic disorder. Or E. Paraphilic disorder. The answer is A. Voyeuristic disorder. Voyeuristic disorder involves observing unsuspecting persons who are naked, undressing, or engaging in sexual activity. The DSM requires at least 6 months duration of this behavior. The person must be at least 18 years old, and there must be distress, impairment, or acting on these urges. Important to note for the exam is the age requirement is at least 18. So they might test you on someone that's, say, 13 and doing these behaviors, and they would not meet criteria for voyeuristic disorder. This would just be considered normal adolescent behavior. Question 3. A 29-year-old man becomes sexually aroused when rubbing his genitals against women in crowded subway cars. The behavior has occurred repeatedly for the past year. Which diagnosis is most likely? A. Exhibitionistic disorder. B. Voyeuristic disorder. C. Frotteuristic disorder. D. Fetishistic disorder. Or E. Sexual sadism disorder. The answer is C. Frotteuristic disorder. Frotteuristic disorder involves touching or rubbing against non-consenting people, usually in crowded public places. On an exam, you might see this person on subways, crowded elevators, or concerts, somewhere where they can easily rub up their genitals against people. Question 4. A 50-year-old man reports that he can only achieve sexual arousal when wearing women's clothing. The behavior causes distress and interferes with his relationship. What diagnosis best fits? A. Gender dysphoria. B. Fetishistic disorder. C. Transvestic disorder. D. Sexual masochism disorder. Or E. Voyeuristic disorder. The answer is C. Transvestic disorder. Transvestic disorder involves sexual arousal from cross-dressing. An important distinction between transvestic disorder and gender dysphoria is in gender dysphoria, there's distress from a mismatch between gender identity and their biological sex, whereas in transvestic disorder, there's sexual arousal from cross-dressing. Question 5. A 45-year-old man is sexually aroused when using a specific object, such as women's shoes. Without the object, he cannot become aroused. Which disorder is most likely? A. Fetishistic disorder. B. Transvestic disorder. C. Sexual sadism disorder. D. Voyeuristic disorder. Or E. Frotteuristic disorder. The answer is A. Fetishistic disorder. Fetishistic disorder involves sexual arousal from non-living objects or specific body parts. Examples would be shoes, underwear, the notorious foot fetish. But these fetishes must cause distress or impairment to qualify as a disorder. Someone could have a foot fetish but not be distressed by it, and then it would not be qualified as a disorder. Question 6. A 27-year-old man reports difficulty maintaining an erection during sexual intercourse with his partner. He reports normal erections during masturbation and upon awakening. Which condition is most likely? A. Erectile disorder due to vascular disease. B. Psychogenic erectile dysfunction. C. Premature ejaculation. D. Delayed ejaculation. Or E. Hypoactive sexual disorder. The answer is B. Psychogenic erectile dysfunction. So clues that you're going to look for psychogenic erectile dysfunction are normal morning erections, normal masturbation, occurs only with the partner. Organic ED typically shows global erectile dysfunction. So if it was due to a vascular disease or maybe secondary to a medication, you would not see morning erections or normal masturbation. It would just be across the board erectile dysfunction. Question 7. A 38-year-old man taking sertraline reports an inability to achieve orgasm despite adequate sexual stimulation. Which sexual dysfunction is most likely? A. Erectile disorder. B. Delayed ejaculation. C. Premature ejaculation. D. Hypoactive sexual desire disorder. Or E. Genital pelvic pain disorder. The answer is B. Delayed ejaculation. SSRIs are commonly the cause of delayed ejaculation or anorgasmia. Other causes include neuropathy, diabetes, spinal cord injury, and other antidepressants. Now, they will frequently ask you about this common side effect in patients that are taking SSRIs. But if you have a patient with premature ejaculation, SSRIs actually can be a first-line treatment to help delay that ejaculation. That also can show up on the test. Question 8. A 32-year-old man ejaculates within 30 seconds of penetration despite attempts to delay ejaculation. What treatment is most appropriate? A. Sildenafil. B. Testosterone therapy. C. Paroxetine. D. Bupropion. Or E. Buspirone. The answer is C. Paroxetine. As we discussed in the previous question, premature ejaculation treatment is SSRIs. Paroxetine actually has the most probability of sexual side effects out of the SSRIs. Other options are cognitive behavioral therapy and topical anesthetics. A 30-year-old woman reports persistent lack of sexual interest and fantasies despite adequate relationship satisfaction and normal hormone levels. Which diagnosis is most likely? A. Female orgasmic disorder. B. Female sexual interest arousal disorder. C. Genital pelvic pain disorder. Or D. Sexual aversion disorder. The answer is B. Female sexual interest arousal disorder. Female sexual interest arousal disorder combines low desire, low arousal, and symptoms must be at least for 6 months. Question 10. A 28-year-old woman reports severe pain with attempted vaginal penetration that leads to avoidance of sexual activity. Which disorder is most consistent? A. Dyspareunia. B. Vaginismus. C. Genital pelvic pain penetration disorder. D. Female orgasmic disorder. Or E. Hypoactive sexual desire disorder. The answer is C. Genital pelvic pain penetration disorder. So for this disorder, the DSM-5 combines dyspareunia and vaginismus into the genital pelvic pain penetration disorder. The symptoms are going to include pain with penetration, fear, anxiety about pain, and pelvic floor tightening. For more practice questions, click on the playlist. Subscribe to get new videos every week. Good luck on your exam.